So in most cases, it's just, I like to put you in different categories, mild, dry eye, or level one, moderate, severe, and go on. If I can catch your dry eye in the very early phases, I like, level one or mild dry eye, where your symptoms are mild and they happen frequently, but they're not debilitating. And so a lot of those cases, we're able to start with what I call like our foundational or homeopathic approach, where I usually recommend some home therapy for you. That's going to include a way for you at home to heat up those oil glands, as well as make sure through nutraceuticals that you're having the right proper diet. So I usually prescribe a vitamin supplement for you that's going to encompass omega-3 complex. And then we make sure that we keep the lid margin clean. Keeping the lid margin clean is important to manage bacteria. If you're in the early phases of dry eye, that usually works very well for patients. And then there's some patients that come to me at a more advanced state, and then we'll look at if topical therapy is going to be an option for you. There are several different drops that can be used to manage dry eye. There are also nasal spray. So there's a nasal spray that is FDA approved called Terbea for dry eye disease. We can prescribe that. And if those things don't work, in addition or separately, we may have to add some in-office therapy. That in-office therapy is going to include a tense pulse light therapy, which we have that technology here that has like a trifecta effect with managing dry eye. It works on inflammation, bacteria, as well as the oil in the oil glands. We have low light level therapy that works on the bacteria load as well as the oil. We have tear care, which works specifically on the oil glands. So it's a form of thermal pulsation. So there's a gamut of things that we can do now. We're in a very, very good space with dry eye managing, diagnosing it, and being able to get patients to ability to be comfortable. Unlike 5, 6, 10 years prior, we could diagnose you, but then we have a lot that we can do to get you comfortable. I still like to tell patients there's no cure. So you hear me saying to get you comfortable. We still don't have a cure yet, but we definitely can make you a lot more comfortable and help you restore a lot of your daily life functions.